I'd like to talk to you about time management for doctors. And doctors are late for 10 reasons, so we're going to look at each one of them and how to fix them. So number one is delegation. The whole idea of time management for everybody in the world is to try to get someone else to do your job for you. So you have to ask yourself, does this require an MD to do this job? You know, things like demographics, things like telling your patients where the specialist office is. That's the job of your secretary, and she can handle that. And she can handle that over the phone. You know, 90% of the time when patients want to talk to you on the phone, your secretary can handle it because they're just asking technical questions that don't need an MD for it. So also you delegate to nurses, and you have to be very specific with them. You know, when you're writing orders in the hospital or at a nursing home, be very clear, number your orders, print them nicely or type them nicely so they're unambiguous. We delegate to specialists too as family doctors. So if you can't handle a problem, it's getting too big for you, you need a second opinion, you're suspicious of a cancer somewhere and you just can't find it, delegate that to a specialist. Also, delegate to the patient themselves. Patients, we want to get them involved in their care. They can Google stuff and bring it back to you if it's detailed, and get them to be an expert in their own disease. Like people with diabetes should know as much about it as you do. Delegate to a nurse practitioner. I work with a nurse practitioner. She's fantastic. She can do everything I can do. She can write for narcotics, take away your license, all those horrible things that we get to do. I don't know why they want to do them, but they're doing it. So try to get other people to help you as much as you can. You can't do everything for patients by yourself. Delegate to diabetic daycare. Delegate to the COPD clinic. Things like that can spend way more time. Delegate to a social worker for counseling. The second cause of doctors being late is too many patients, and you know that's a problem right across Canada. There's millions of patients without a family doctor. So, but you've got to protect yourself. Everybody will try to dump patients on you. If you're a new young doctor, they'll say, you got to take my brother, or you got to take my uncle, and you've got to stop and say, you know, how many people can I comfortably look after? Because if you get too many, you'll be late all the time and exhausted and do a crappy job for them, and you'll be crabby too. So if Aunt Mabel phones and says, you got to be my doctor, you got to be my doctor, you said, I'm sorry Aunt Mabel, I can't help you, but I can try to get you to somebody else that can be your doctor. Don't get guilted into it. Number three is paperwork. So everybody, hey, and I talk about computers and paperwork. We don't have a lot of paper anymore, mostly computers, but I'm talking about lab and x-ray and specialist notes and giant forms. So that kind of stuff just sucks the life out of us and takes, you know, 5 hours a week. So I always teach everybody to love paperwork like I do. I come in here every morning from 8 till 9, that's right in my calendar, and I do paperwork and computer work, and then it's all done by 9 o'clock. If I'm on vacation, I come back a day early and I'm in here for 8 hours doing paperwork. Great way to have a vacation, but when you start on the Tuesday, you're a much happier person. So sometimes you need a vacation from your vacations. Number four is interruptions. So I don't have a phone. You can see here there's no phone. I don't answer my iPhone. My secretary screens all my calls. Most of the stuff can be handled by her, and she can just text me the things she can't handle. And I teach her lots of stuff. I've taught her how to triage properly, how my brain thinks. So we work as a really good team, and I'm always checking up and seeing how she's doing. Like everything has to go out under my purview. Also, if patients come in with a list, you know, if they come in and they have a list for you here like this, and they say, gee doc, I got 5 problems today. What you do is you say, can I look at that list please? And you take possession of it, and then you quickly scan through there, make sure it doesn't say chest pain down my left arm, because that means you dial 911 and chew 2 baby aspirins. But if it's 5 unrelated problems that are chronic, you can say to the patient, you pick the top 2, we'll do them today. and the other 3 will book you for a full physical to do all of those. So they feel like they're getting looked after, but they're also not sucking a half an hour out of your day and then your waiting room is full of patients. So you have to be able to see people within 10 minutes. Now sometimes you can rob Peter to pay Paul. You can see a healthy young guy with cough or cold, with not COVID hopefully, and get him looked after within a few minutes, and then steal that time for somebody else that might come in with a bigger problem, harder to diagnose or needs some counseling. With seniors, people like me, I have tons of seniors in my practice because they age with me, and they have all the time in the world, and they love coming, and you're a big social event and they think you look young and handsome because their eyesight is terrible. So you need to, talk to them carefully. They read lips, talk loud and slowly so they can hear you. You need to take their medications and write on here in big letters for blood pressure, for heart. And I usually go through all their medications with them because they've got them all mixed up. And if they don't know what the pills are, I don't spend time trying to guess. I'll go out and get my secretary to call a pharmacy, go see other patients, come back when I've got the proper list. If you guess wrong, you can get in big trouble. So I'll say what's new, and we put them in the middle of the day, so we keep 4 to 5 for students and workers, and then people in the middle of the day. And my secretary always makes them bring a caregiver with them, because they are going to be taking notes and asking questions, and they can, and she says bring in all your medications from all your doctors as well, because they can't remember what they're on, and they think we all communicate with each other like Visa and Interact do. So also outside jobs. So I usually try to stick to 1 job a year, that I volunteer for to help out with the hospital or the community, and I try to make the meetings to suit my schedule. I'll say I can do it from 8 till 9 in the morning or 12 till 1. I can't do, from 3 to 4 on a Monday afternoon when I have patients. Another thing is to reason doctors are late in Canada is there's no competition. We're a monopoly. We're the only country in the world with totally free medicine for the patients, but that has a cost. We have huge waiting lists, and we have lots of people without family doctors, so there's no free lunches here. If you have a free lunch, you're going to have a lineup. So that can make us lazy, and we can say, oh, patients can wait for us because they can't go anywhere else. There's no competition. But competition is coming. Nurse practitioners, physician assistants, I've worked with them. I think they're wonderful. I've trained them. I think they're great, but they're coming. And politicians look at them and say, wow, they're a lot cheaper than us. So, we've got to make sure we compete. And if we're on time, patients will come and see us. If we're not on time, they're going to go to a walk-in clinic. If you're fee-for-service, you're going to lose all those little easy cases. If you're in a rostered, capitated system like me, we have to pay for that 100%. If my patients go to a walk-in, I take out my wallet and pay that doctor 100%. So my outside usage is tiny because I'm a good time manager, because I do all these things that I'm telling you here. Psychological counseling, huge time sucker too. So talk to the patient. Do they have an employee assistance plan? Most do. Most do if they're in a union. So try to get them there. They have a lot more time for them than you do in 10 minutes. They're better trained than you, and they're objective. They're not your family doctor. They don't know you and your wife and your kids and your parents and all 4 generations. Especially like marriage counseling. With marriage counseling, they'll often say, well, my husband won't go, and you say, well, go alone. It's better than not doing anything. And it's good to have a neutral person. If they come in and you're doing marriage counseling, one of them will always think you're on the side of whoever you're the doctor for. And they'll say, I can't afford marriage counseling. And I always go, well, a divorce costs you $300 an hour for a lawyer, and you lose half your assets. So it's, you pay me now or you pay me later. And last but not least, we've never been taught to be efficient. You know, we don't get taught these things in medical school. The professors are busy, they're writing, they're doing research, they're teaching us, and they're teaching us to go slow, and that's a good thing. You know, we don't want to make mistakes, but when we get out here in our own practices, we have to see a certain volume to, you know, pay the rent. So, and the professor has you to do all their paperwork and typing for them. You have nobody to do that. So they don't really focus on that. So this is the first time you've been taught to be on time. Thank you.